This is a presentation to go a bit through a journey that HLA has been on for the last couple of years, and then also some of the new offerings that it is making available to its membership. So first thing you'll see is there's a new logo. So HLA has come up with a new logo. That responsibility is a bit of a tagline that a bunch of people sat around, 8 logisticians came up with, but it's a useful logo, and it's a useful kind of recognition that HLA wants to evolve and be representative of its members and its followers going forward into the future. So who is HLA? So HLA originated with a Marco Polo declaration, which was literally a bunch of leading humanitarian logisticians writing a declaration down on a piece of paper in a emergency response back in 2005 to establish a professional humanitarian logistics association. So an association that could represent the body. It was registered as a charity in the UK in 2009, and we can see here the structure that it has. So it has a board of trustees, registered trustees. It has an operations team, which I head up. We have an advisory group, which is leaders from different sectors around the world that has been in existence since HLA was set up. And that advisory group sense checks whether HLA is what it's doing and what it's offering to the sector is valuable, is useful, and it's still relevant. And they meet about once a year and sometimes more often to do that sense check. Then HLA has set up advocacy groups, which I'll go into in a bit more detail in a little bit. The Local Procurement Learning Partnership you may have heard of, another one, the Health Humanitarian Supply Chains Advocacy Group, and one we're in the process of setting up, the Last Mile Advocacy Group. And as well as that, HLA has co-leads the annual Health and Humanitarian Conference with Georgia Tech University in the US, the HHL conference, with the conference this year in November in Brussels at ADEX, but I'll give a bit more detail on that. So this is just who is HLA. Since inception, HLA has done a lot of stuff. It's become recognized. It's created a large network. So there's about 13,000 followers across the various HLA social media channels, website, and its newsletters. So we have a lot of followers, and those followers are spread all over the world at all different levels and come from multi-sector, so public, private, aid, academia, and the splits and spreads are quite equal. So there's quite a good diversity of followers across the network. We've developed an awful lot of partnerships. I'm not going to go into them all, but CILT and IAPHL, the Chartered Institute of Logistics, the International Association of Public Health Logisticians, Logistics Cluster, Strathmore University in Kenya, the Impact Customs Project, which is all about customs and imports, Global Business School Network, Pharma Aero, which is another association representing airport associations and how they do import and so on. So we've built a lot of partnerships and networks to try and enable HLA to achieve its vision and mission. We've worked with a whole bunch of partners to develop research over the years and to get involved with research. We've supported interagency initiatives like the Parcel Project, the ULS, the Universal Logistics Standards, and doing some work with the ESOP's Emergency Supply Provisioning Strategy Project. We have also engaged with the Logistics Cluster, and we're also working, going to start engaging and working with the HELP, the Kuna HELP Logistics Initiative. We have supported and do support the knowledge library. So the HLA knowledge library has been built, is in place, and is starting to be populated with knowledge, documents, research, resources from around the sector. Moving on, time for a refresh. So in 2019, 2020, HLA ran several surveys. Some of you may remember them. And we also did open consultations, hosted webinars where we asked any interested parties what they saw as the best value that HLA could bring to the sector. And that involved a lot of time, a lot of effort, and a lot of discussions. And we had really useful feedback. And the main points were HLA to support better cross-sector engagement, make it easier to find and improve information sharing, a safe space for aid logisticians to connect, discuss, learn, and share. Improved access to market information. There was an awful lot of feeling there was a lot of information held out there, but it's not accessible easily and not shared easily between stakeholders. Find complementarity between different initiatives, often disconnected initiatives that are in the sector, and that concept of avoiding reinventing the wheel. And create a space to capture and share information and learning. So this was kind of the main feedback that we got, where HLA could add value to the sector. And from that, we came up with an impact model, effectively a strategy. And part of that strategy was to move from the current model of HLA, which is 100% volunteer run. So HLA is 100% run by volunteers. Both myself and George have other day jobs, and we do this in volunteer time. We have a team of about 20 other volunteers behind us who all have their own day jobs. And there is a limit to what can be achieved with 100% volunteer run organization. So within the new strategy impact model, we want to shift it towards a self-sustained organization that can give more value to the members and create more impact in the sector. And self-sustained was an important part of that model, so that we're not looking for donor grants to keep HLA alive. And to note that HLA has been run by volunteers and by sponsorship from various sectors, but not necessarily a lot of big donor grants, because we haven't needed it and we haven't looked for it. And moving forward, the intention is this self-sustained model. So the new HLA strategy or impact model, the goal has not significantly changed. It's about empowering logisticians to drive cross-sector solutions that are locally sustainable and globally enabled, with the intent of delivering aid more effectively. And cross-sector, we mean pulling in private aid, NGOs, public sector, academia, all together and looking at solutions that are cross-sectoral, locally sustainable, but globally enabled. So maximizing and harnessing and leveraging the power of local capacity and local solutions, and adding in a global enabler to that, because a lot of the money sits at the global level. And the goal hasn't really changed, but that cross-sector approach and locally sustainable are probably the new bits that have been added in. The outcomes that HLA wants to see are policy change. So looking at donor aid, private, public sector policies around supply chain management is a key part of it. A global marketplace, working to make information more freely available and accessible and shared between stakeholders, and then empowered logisticians and cross-sectoral logisticians, not just NGO logisticians, but public sector and so on, empowering them to actually be able to help evolve change in their own organizations. To do that, we've come up with these 5 neutral platforms. So thematic advocacy groups, HLA branches, information portal, awareness and training and knowledge sharing, and then the annual logistics conference and awards. And I'm going to go into each of these a little bit over the next few minutes, but I'm not going to spend a huge amount of time on them. But the idea is these are neutral platforms to help us achieve the outcomes we want for the goal that is set. So the HLA thematic advocacy groups, the idea is to bring different individuals together from the different cross-sector parties, and also from the different initiatives that exist out there. So not to create new initiatives or new activities, but to bring a lot of different people together. And the idea is find or generate evidence, shape policy, support awareness to bridge gaps, and leverage that the multiple initiatives to create more impact. And one of the big feedbacks, as we mentioned earlier, from that survey we did back in 2019, 2020, was there's an awful lot of initiatives in aid logistics, but they're not connected and they don't join together to have a more powerful voice or a more impactful voice. So it's trying to do that. So in 2021, we set up the Local Procurement Learning Partnership. Then this year we've set up the Health Supply Chain, Humanitarian Health Supply Chains Partnership, and we're currently in the process of setting up the Last Mile Advocacy Group. Each advocacy group has an executive group that is tasked with giving direction to the advocacy group, and also supporting, looking for funding opportunities for initiatives they want to run. For LPLP, the Local Procurement Learning Partnership, HLA and Field Ready have already signed up, and there is an executive group and a steering committee, and it has already produced some research and is writing current concept notes with UNICEF and others. The Humanitarian Health Supply Chains Working Group includes HLA, People That Deliver, which is part of UNICEF, the International Association of Public Health Logisticians, and most recently Strathmore University in Kenya. And looking together, we're writing concept notes at the moment related to what they can research and evidence that they can generate. And then the Last Mile initiative is HLA, and the dosing group is signing up as a key kind of supporter of that. And we're looking for other stakeholders to get involved in that group as we set it up. Underneath the executive groups, there's steering committees, and these are the technically advisory groups that help generate the ideas that need to be looked into based on the current themes and context and challenges and issues in the sector. And they also support the output, the quality output. So when we actually generate information through these advocacy groups, that steering committee validates what the output is to see, is it representative? Does it make sense? Is it of a high quality? Does it capture the right points? With the advocacy groups, the kind of theory of change is find and generate evidence, get multi-initiative awareness and advocacy and training. So generating evidence is that first point of finding good examples of what good looks like out there, doing research to answer questions, getting evidence-based answers, so doing research with academic institutes to ensure the research is rigorous, and then providing that evidence, those research, those case studies out there in awareness and advocacy and training. So taking that out through HLA, but also through all of HLA's partners and the other initiatives. A big thing is enabling change agents, so enabling individuals within donors, within private companies, within NGOs, within the public sector to make changes based on the evidence that we can provide them. And again, that goes towards our outcomes of shaping policy, open access information, and empowering individuals. To date, the advocacy groups, largely through the Local Procurement Learning Partnership, have produced 3 pieces of research which have been published and been presented at a few conferences, and they're available on the HLA Knowledge Library. The first on humanitarian supply chains during COVID, the failures, the recovery, and the emerging alternatives. A very good and interesting piece of work by Claire Travis and Anna Lowe that looked at how the supply chains kept going even though the global supply chains effectively stopped, and then the positives and negatives around that, and the fact that the local supply chains are actually quite resilient, still need some support and still need to jump hurdles, but they are quite resilient, and that was an interesting piece of research. Localization in the aid sector by Caoimhe McGavin and supported by King's College looked at what are the perceptions, challenges, and opportunities. And that was a good piece to kind of pull out what are those real questions that need to be answered about why aid is not given more locally to local partners. And then a more recent piece of research, which actually hasn't been published yet, but the first draft is with the relevant committee, is evaluating the need for a list of qualified suppliers and service providers at a global and local level. So a more open list as opposed to the list that exists within different organizations. And it was a bit of research to look into what's out there and what would the need be. We have current concept notes with the Health and Humanitarian Supply Chain Advocacy Group for Public Health Supply Chain Gap and Opportunity Analysis in East Africa, and then one with the Local Procurement Learning Partnership with Response Supply Chains, a product-focused study. So how do we make our supply chains more responsive? And that's a lot looking at local manufacturing capacity and so on. George, I don't know, is there any questions at this point? Do you want to field any questions, or do you want me to keep going?
We can pause there if anyone has a question. Maybe this one possibly. The question here is, do you have any HLA branches in Southeast Asia?
Not as yet. So the branches are something that we haven't actually rolled out. So the plan is to set up HLA branches next year. We've been busy doing a lot of stuff this year, but the intent, and we have already started discussions with a couple of countries in Asia and in East Africa to set up branches next year. So yeah, not at the moment, but the intent is to get them up and running and next year, and to do that in partnership with some other existing initiatives that are out there that we're talking to.
Great, thanks. If anyone has any more questions, yeah, please put them in the Q&A. But otherwise, I think it's okay to continue, Andrew. Thank you.
Okay, so on the second of those kind of neutral platforms was our conference, and we wanted to reinvigorate the Aid Logistics Conference that had been run many years ago and stopped about 10 years ago, and then had been taken over to a certain extent by the Health and Humanitarian Conference run by Georgia Tech in the US. And what we did was we wanted to see, is there a gap? And when we spoke with Georgia Tech and with some of the other partners of that conference, there was a recognition that the conference didn't necessarily pull in the voice from the field, and HLA and its followers were potentially that voice that we pulled together. So again, instead of reinventing the wheel, we merged with the Health and Humanitarian Conference, the HHL, and now HLA and Georgia Tech run that jointly. And the other big piece we brought to that conference is to move it from being a point-in-time event to having links to the wider activities that HLA is doing. So the simple graphic here is about the advocacy groups and HLA partners generate evidence. They have ongoing activities of publishing the evidence, webinars, roundtable discussions, and sharing and advocating. And all of these feed into this annual logistics conference. So it feeds into this event where we discuss the findings and the outputs and the discussions that have come out of the advocacy groups and the partners and other current sector issues. And then we feed that back into the advocacy and the policy changes that we want to see. So with the conference, it's, again, not reinventing the wheel, but adding a value of trying to get that voice from the field, and also making it more accessible, which I'll talk about in a second, and then linking it to ongoing activities. So there's outputs and actions from the conference that can be taken forward. We plan to introduce an awards, an Aid Logistics Awards in 2023, and we've had some discussions around that. So there is an intent to introduce something, again, in partnership with a couple of existing initiatives. The 2021 conference, I'm not going to spend a lot of time on that. There is a full report from the 2021 conference on the HLA website. The theme was building efficient supply chain connections, and the key points were captured there in the report, and many of those have been followed on with the advocacy groups and with the partnership work and the research we've done during this year. And they'd also influenced the conference theme for this year, because a lot of it was around disaster preparedness and data and local supply chains and resilience and last mile. So the conference for 2022 is, the theme is strengthening local crisis preparedness and response planning through effective logistics networks. It's on in ADEX in Brussels in November. It has an in-person format, but it also has an online component. So we want to broaden the participation as much as possible, and we're making the access to the conference free, so people can access it free of charge, because we want to get as much participation as we can. As said, it's co-led by HLA Georgia Tech, lots of supporters that you can see here, and a main sponsor this year of UPS Foundation, plus some others. Again, on the website is the full details, but these are the things we're trying to make available to the HLA followers and members, is to give them a space where we can talk, discuss, and try and influence change. The other thing that we've built out is the HLA member zone, and that's about providing more tools and information and services to members and enabling members to participate in creating safe spaces. This slide is a bit heavy, and I'm not going to go through all of the detail. Let me see if I can hide this piece up here. Effectively, what we're trying to say is, with the new HLA model, we've created a lot of benefits, and it's about access to knowledge, access to information, ability to engage with peers and partners, get involved in communities of practice, write blogs, write news, add news, and post it out in the sector. So we've created a new member zone where members can access a lot of this. The headers on this table are basically what is open access and open to the public. So we want to keep a lot of the information that we've always had still available and open to anybody, freely accessible on the website. Then the next column is individual members. So if you do decide to become a member, there is more value that you can input into research projects. You can access the consultancy register, get involved in communities of practice. We've created a tool where you can ask peers questions and comments, connect with your peers. You can post blogs about things that are going on in your space. And in 2023, we'll be making a global supplier register and a training register. The training register will highlight training providers that HLA has done some sort of validation and feel that they're valuable to the sector. The supplier register is something that HLA and a bunch of other peers are debating at the moment. What's the best way to make a more open access supplier register available? So there's a lot of debate around that one, but we intend to put up something in 2023, and then the local branch is coming again in 2023, and the membership gives you access to those. There is also organizational membership, which gives you access to all that. The big advantage of the organizational membership is if an NGO signs up or a private company signs up, they can give free access to their staff. So staff don't have to pay the individual membership fee. And they can also directly manage what their staff can and can't do in the system, and they can manage the quality control of that. With the tenders and jobs, we've created, again, not to reinvent the wheel, we've created links and feeds with Relief Web and IAPG, so they're fed from there. But also with the new system, a local field logistician in South Sudan can actually get access to go in and upload a local tender, and they can just put it in directly without a need to send it to their HQ or get permissions or anything, assuming they've been given access by their organization. So it's about creating a portal and a tool that gives a lot more functionality, creates a lot more data, puts a lot more information and data in one place where people can find it. Let's have a look. So I was going to quickly just give people a sense of the new HLA website. So this is the new look and feel website. It's got all the public information available. So events in the conference, resources, jobs, tenders, the knowledge library, blogs and news. Advocacy groups of public, people can access a lot of information. The general public, anybody can access without becoming a member. If people do want to become a member, and then we have created this new member zone, and there's a registration process and a login. And with that member zone, in there, people can begin to interact. Now, there's a lot of information in here. We have created a lot of how-to videos, which are available on the homepage, and we'll be doing some webinars specifically about how to navigate the new member zone. And when people create blogs or news or knowledge library events, they can do it in here. People can access the directory to find other members, find consultants, find organizations. They can go to My Communities and they can create groups and communities to engage with, and they can be public or private or invite only. And then they can create their own posts and news. So this is the space where we want people to come in and interact and send direct messages to each other, get involved in the groups, and again, post their news and blogs and add in knowledge to the knowledge library, post up events. So if events are happening, they can be seen here. So if multiple different initiatives are doing events and they have them on their websites, they can also put them in here to try and have one place to have it all. Finding jobs and suppliers to find tenders. So in this member zone, our members can add in jobs and add in tenders without any need to come through us administratively. They can just do it directly. And when they add them in here, they become available on the public website. So suppliers can come and find them here easily. And that's local tenders as well as global tenders. And there's no cost for adding. You can add as many tenders as you want. And each organization can give as many people access to upload those tenders as they want. I'm not going to go through a huge amount more, but this was just to give you a flavor and a sense. So our next steps are to begin communicating the value and the benefit of HLA's neutral platforms, these advocacy groups, the conference, the awareness and the information portal, the member zone. Get as many of our current 13,000 followers to become members and start gaining these benefits, and then enable those members to actually use the benefits. So give training and awareness webinars and videos and so on how you can benefit and use these tools. Promote, we're going to do some promotion work on promoting the jobs and tenders and consultant registers. So if you do post your jobs and your tenders, we want to start promoting it to suppliers and to recruiters so that that becomes a place where they go to see, is there a tender relevant for them or a job relevant for them? We want to evolve and grow the inter-initiative impact of the advocacy group. So start to build out the advocacy groups more. And we want to get continual feedback from you, the members, on how we can improve these services, because we are building this as we go. We are a volunteer kind of group doing this on behalf of the followers and the members. And we do continuously go back and ask people what they think. Is this relevant? Is this useful? Do we need to do different other stuff? And in 2023, we want to build out the supplier and the training registers, and also to build out start building out the HLA branches. The offer, I think it was in the invite, is that individuals can register and join for free if they register before October 31st, and we will send out a link to how you can register. Consultants can register to be in the consultant register for a 70% discount. It's normally $90 a year, but it'll be a 70% discount until October 31st. And organizations can register to join for a 30% discount. All the prices are on the website, but these are the discounts with the intent of trying to get a lot of people in. We don't want the price to be a barrier. The price is more about, as we said at the very start, enabling HLA to do more for its membership, for its followers, and offer more to the sector and more impact. But we need some money to make it a self-sustaining organization, and the membership model is how we do that. But we've purposely tried to put the price points low enough to not be prohibitive. So individuals can sign up. It's $35 normally. They can get in for free now. Consultants, $90 normally. They can get in with a significant discount. And organize significant discount. And remember, if your organization signs up, they can give you free access without you needing to pay for that individual membership. And if your organization signs you up, you have more functionality that you can do within the member zone. George, I'm going to stop there and open it up for any comments, thoughts, questions. If you can maybe field those, George, that would be great.
Yes, thank you very much, Andrew. That was very good, very helpful, and we've had some positive reactions. So we had another question about going back to the discussion on branches. So a bit more clarity around our intentions for establishing national or local branches. Maybe you could speak to that.
So the intention, and it comes from, again, an existing initiative, well, an initiative that had existed for quite a while called the Last Mile Club, and they had started setting up kind of local last mile clubs in different places around the world. There were several of them, but that initiative kind of faded away. And the idea was to have a local branch with a local coordinator and to be funded through the new HLA funding model, whereby they would pull together public sector, private sector aid, and local academia to debate and discuss points of concern and issues in a particular context, region, or country, and to promote solution finding, cross-sectoral solution finding. And that would include bringing in guest speakers from the multiple sectors. It also, in the Last Mile Club, it involved visiting warehouses, good practice warehouses, to see how something could work and showcasing good practice. And it also involved writing white papers and letters to donors to tackle certain issues, and that to be supported by the Global HLA Initiative. The IAPHL have local branches, CILT have local branches, and we've started discussions in those spaces to see, can we kind of pull these things or some of these initiatives together to not have another branch mechanism as opposed to trying to build it into the existing mechanism. So that's where it's going to take us a bit of time to kind of try not to reinvent the wheel, but the intent is to get some up and running next year.
Great. And we had another question from Kisikedi about asking if on the platform, is there a place to submit project proposals for fundraising? Project
proposals for fundraising, as in you're seeking money. We don't have a space for that at the moment. Anybody can post anything. So once you're in a member, you can do a general post to the whole community, or you can try and connect with the community through a group, and you can say, I'm looking for funding for this, but we don't have a direct mechanism for that. If that is something that people feel is useful, and we take it to our advisory group, because that's the function of the HLA advisory group, is to kind of vet any new offerings or functionality to make sure it's neutral and it's transparent and it's within the remit of what HLA can do. So I think, George, what we can do is capture that as a potential offering for the future, and then we can discuss that with the membership. So we would put that out to the membership through one of our surveys and so on, and we would also discuss it with the advisory group. And if there's a feeling that it can add value, recognizing we'd have to clarify the scope, then it's something we can build into. So HLA has got resources to add new service offerings and new functionality.
Great. Now we're just answering a couple of questions about the conference. So this year the conference, as Andrew was saying, is aligned with ADEX in Brussels, and yeah, the facility for the conference will be within the ADEX exhibition area, so that we can have interactions with some of the suppliers who are also participating in the conference, and one of our key sponsors will be there to demonstrate latest innovations around cold storage. So we'll have, it'll be a sort of an interactive event. Of course, it'd be great if you can attend physically, but there will be some capabilities for online access to keep up to date with, up to speed with what is being discussed, and provide inputs and questions. So any other points we would be very welcome to answer. If anyone would like to speak, please raise your hand, and I can give you access to speak. But otherwise, and in terms of the accessing free membership for individuals and discounts for others, Andrew.
So we'll be sending to all those who have attended this webinar. It's one of the perks of having attended. You will get an email with a link to give you free access, and the link will be for individual member access. If you do want to join as a consultant, you would then email us back, and we would send you a separate link to avail of the discount. And organizational members just need to contact us, and we onboard them in a separate onboarding, and that's done between the organization and ourselves. So there will be an email going out to people who join this webinar to offer you free access, and that link will be valid for 2 months to the end of October.
Great.
I think one question I would pose, and maybe people don't necessarily want to talk, but is this and does this offering make sense, and do people think it will add value, and it is something that they would use? Because that will be the crux of this. We're here, HLA is here to provide services for its followers, members, and if you don't use it, then we disengage with that particular functionality, and we build something else. So it is a question to all on the call: do you feel you would use this? I don't know, George, can you do a quick poll to that?
Okay, well, that's very helpful. Thank you very much. So far we've got yeah, 93% say yes, it will be useful. So that's very, okay. We're very happy with that. Thank you.
Great. And again, we'll give access to people. We will be hosting a webinar. I think it'll be about in 2 weeks' time. So a lot of people are going to get access to the website over the next while. And the next webinar will be very specifically on how to navigate and use some of the functionality. It is relatively intuitive, but it's always good to get some pointers. I would also note that on the website itself, on the main website, I'm just gonna close the chat. We have an FAQ section, frequently asked questions, and these are some questions. How do I log in? How do I post on HLA Members Zone? How do I register to become a member? And so on. And we're starting to build out these FAQs, and they're little 1 and 2 minute videos just to walk you through. It's literally screenshots of how to walk through that process. And we are going to build on more of these how-to videos. So as we get questions from you, the members, on functionality, we put that into our roadmap. And as we get questions on how to do something, where it's needs a bit of tweaking, we'll tweak it, because it is something we're building as we go. And where it needs more guidance, we'll add in webinars and how-to videos. So it's important that we want to make information available to help you use this tool.
Just had a question from Daniel asking, are there membership certificates for members?
And George, I'd say you're best placed to answer that.
Well, yes, I mean, we would like to be able to provide membership certificates, absolutely. We are able to do that. As you say, it could come at a reasonable cost if people were happy to pay for their membership and cover the postage costs for the certificate. That's easy to do. What we have done, which is in the past, and we aim to do again, which is at no cost, and it's very easy. The easiest option really is to provide digital certificates. So. And I think there's more recognition now than previously of the use of and recognition of digital certificates. So we can provide digital certificates, and we also give members the opportunity to we can provide a member logo for you to attach to your email signature, etc. So we already can do that easily. We just, I suppose, will send out a survey at some point just to determine how valuable a physical certificate would be for you. And then we've got another question. Hello, if I got this invite and all HLA communications, does it mean that I'm already a member and doesn't need to register a second time? This is from Innocent. No, you will need to register as a member, and we will send you the link to do that. And
what I would say, George, is there's several individuals who registered as members in the last while, and they've been given membership, but the communications tool within the member zone wasn't fully functioning. It is now fully functioning. So what we can probably do is send an email out to all existing members to say you are a member and this is the link where you can log in. So yeah, we will send that email out, and we will also send an email out with the link for free membership sign up. If you get the email that says you are already a member, then you don't need to sign up again.
So I'm just looking at the points in the chat here. This is from Hayden saying, I've been asked by several people, and the membership number is a popular request to create a stronger link. Yeah, that's a good point, Hayden. So we can provide, everyone in the system will have a registration membership number, so we can make sure that you are aware of your membership number. And then we've got another question here from Masaf Muhammad. One of the major challenges right now is the lack of capacity, especially at local level when implementing humanitarian responses. Will HLA in any way be supporting providing certified trainings at local level to build capacity, especially for junior staff to mid-level managers?
And I think that's HLA's role, is to try and pull all the different bits together that are happening out there in the sector to help exactly with challenges like this. So under the advocacy working group, under the Health and Humanitarian Advocacy Working Group, one of the things we're looking at right now in East Africa is to do a kind of gap and impact analysis on the health supply chains, the national health supply chains in Kenya specifically as a case study, but more looking at East Africa, with the intent of helping, and that project is going to include the ministry and the public health supply chain working groups and so on, and the national institutions involved in supply chain in the country. And with that gap analysis, it is about then identifying where the gaps are and then working with our other peer organizations to help with JSI, with IAPHL, with lots of others to try and identify and target what training is needed and where it can be valuable. Again, HLA isn't going to get into the provision of training because lots of others do that. What we have tried to do is link with those others, and then we try and identify where the needs are in a kind of systematic, structured, strategic way. And then we work with those partners to say there's a real need and focus here. Can you deliver training, or can we find funding to support you doing that? So the answer is yes, we want to work towards finding money to do exactly that. That is less about the member zone and the website, but it is very much within the remit of the advocacy groups.
I just wanted to, because we're coming up to the hour now, just wanted to pick up on a couple of other questions we had. One from Zamin Khan, who's asking, will the contact information of the members be shared or visible? Like if I want information on South Sudan, so I can contact a member and get that information. I think the answer to that one is yes, but do you want to explain that a bit more, Andrew?
Within the member zone, there is a members directory where you can find other members, and finding them depends on how much information a member's put in, but if members put in the country that they're in, it's easy to find any members within that country. So yes, within the member zone, you can go to the directory and look for other members based on the information they provide.
So we just, there's a few other points. I don't know whether you saw these in the chat. Yes, how much is the conference going to cost? It's free. Yeah, we had an HLA conference in Nairobi in October 29. Yes, we want to do more conferences in Kenya and other key hubs like that in other parts of the world. So that is definitely an intention, is to go back to physical events, but trying to make sure that we have the virtual component also. Matthew is saying, for anyone on this call would love to connect via LinkedIn. Okay, I think, what else? Is there an HLA plan to come to DRC in Africa? Well, yes, possibly, and we would like there to be a DRC chapter of HLA at some point in the future.
And I think, George, that's good with time as well. So
yeah, I think we're on the hour now. Yeah.
Yeah, the hope from today was just to introduce people to the new offerings that HLA has, and to try and encourage people to move from being a follower to being a member, sign up and go in and start using the functionality, the tools that we're making available, and feeding back to us. There's contact section in the website, and sending us feedback and saying, this isn't working, there's some website stuff that might need tweaking, or we find this less useful, we find this more useful. Because we need to keep evolving and building this based on what you and the membership are telling us we need to build from a members own perspective, and then separately from the conference and the advocacy group perspective. It is about hearing from you and the members to say, and we will be reaching out to you with different initiatives through the advocate groups to get your opinion. So we reach out to members, that's not to the general public, but it is to members to say, this is something we're working on, or a piece of research. Does anybody want to be involved, be interviewed? Is there anybody with strong viewpoints that feel need to be considered? So it is about, now that we've kind of got this up and running, and today is effectively the launch of this, it's about getting people involved and getting your input and opinion, and getting you to use these services and let us know what are the good ones and what are the ones we need to improve upon.
Great. Thank you very much, Andrew. And thanks to everybody for your participation. I know that we didn't give you a huge amount of warning, so we were very happy that we had such a positive reaction to our invitation, and we look forward to being in touch with you all, and hopefully having you all sign up as members of the network. And your comments and questions are all really very useful for us, and the aim is to continuously improve the platform that we've created and make it as useful as possible to everybody. So with that, I will close the webinar today. We have recorded the session, so we'll make that available online through our website. Thank you very much, and goodbye to everyone.